Hi, everyone. My name is Dr. Kristen Lindgren, and welcome back to the podcast. This week, I'm going to try to stay out of the crosshairs of the algorithm and talk about something not on the list of things you can't talk about: cholesterol, statins, and heart disease. We'll see how this goes. I dug back into the archives for this one, folks. This is the remastered version of You Get a Statin, and You Get a Statin, and You Get a Statin. I'll link to the full post below. I don't think a day goes by that we're not trying to undo the stamped in concrete mainstream narrative that cholesterol causes heart disease. It took long enough, but there's a mounting number of physicians, including cardiologists, who've actually taken the time to learn the truth about this long held belief and are bold enough to speak out about it. If you're interested in learning the real story behind cholesterol, heart disease, and statin medications, then grab your headphones and let's go. A news article published in 2023 wrote, researchers report that only 35% of adults who are eligible to take statins for prevention of cardiovascular disease are actually using them. They said that misinformation about statin side effects could be a factor. Reading scientific studies takes skill and practice, and caffeine, a lot of caffeine. The authors of these studies are assumed to demonstrate at least a modicum of integrity when conducting research. Otherwise, what are we even doing here? You're not allowed to cherry pick studies whose results don't align with your interest. You're not supposed to pay people off to falsify study results. You can't change the endpoint of your study halfway through because the data isn't turning out the way you predicted. And you certainly can't pull participants out of your study because they reported having side effects from your medication in order to make your results look better. But they do. They do it all the time. When you publish a paper, you're expected to disclose conflicts of interest. Why? Because it's unethical not to. That's why. If you have no conflicts to disclose, it lends credibility to your research findings. It means what you're saying is probably legitimate. Otherwise, I don't know if I'm reading real information or just some shady. It's sad to say, but data manipulated, industry funded science forms the very foundation of mainstream medicine as we know it today. Studies cost money, lots of money. Who has money? Pharma has money. If someone wants to promote a finding or make it disappear, it takes dollars to make that happen. Heart disease, cholesterol, and statins. Wading through the swamp. Heart disease is the number one cause of death in this country, period. For decades, it was believed dietary fat and saturated cholesterol were the drivers of this disease process. That conviction was so strong that the winners of the 1985 Nobel Prize for discovering statin medications predicted the eradication of heart disease by the early 21st century. 40 years and billions of statin prescriptions later, heart disease still sits in first place for death. What is coronary heart disease? If you're reading this, chances are pretty good you have a heart. Having a healthy heart is a big deal because your heart has a big job. It has to pump oxygenated blood through miles and miles of blood vessels to all the rest of your body, or you will die. No oxygen means no working organs. That's no good. The heart not only has to pump oxygen to your entire body, but it also has to pump oxygen to itself to keep working. Simply put, heart disease is when there's a problem with your plumbing, a blockage in the system preventing oxygen from getting to arguably your most important organ, your heart. What are statins? These statins are a powerhouse class of medications used to lower cholesterol. The first statin medication was developed by Merck in 1987. Currently, there are 8 statin medications approved for use by the FDA, and close to half of the American public is taking one. More than 1 billion people worldwide are taking these drugs. Some quick math means pharma is grossing more than $1 trillion in annual revenue from the sales of statins alone. That's because they work. There's no question that statins lower cholesterol. There's no question that heart disease kills more people in this country than any other disease. The real question is behind door number 3. Does cholesterol cause heart disease? Let's get into it. What we thought caused heart disease. A short story. Well, cholesterol, right? Too much red meat, too many eggs, too much fat. Everyone knows this. They told us that for years. Cholesterol is fat. Fat makes you fat. Stop eating fat. Come with me on a brief walk down memory hole lane, shall we? Let's go all the way back to the 1950s. Once upon a time, there was a guy, a scientist whom we later learned was bought and paid for by the sugar industry, a man by the name of Ansel Keys. Ansel had a theory, one that would shape dietary guidelines for decades. He believed dietary fat and cholesterol were the root cause of heart disease. Sounds logical, no? So he conducted a study, collecting data from 23 different countries. Unfortunately, he found there was absolutely no link between dietary cholesterol and heart disease in 16 of the 23 countries. So he just threw all that data in the garbage. And with the 7 remaining countries' data, the lipid hypothesis was born. The sugar industry, eager to keep its cash cow alive, threw its weight behind this hypothesis. They paid off Harvard scientists in the 1960s to shift the causal blame of heart disease from sugar to fat. The result? By the 1980s, low fat was the new health gospel, and cholesterol was the target. Enter the birth of statins. Pharma saw this as a golden opportunity. If cholesterol caused heart disease, then a drug that lowers cholesterol must be the answer, right? Well, there was a problem, a big problem. At the same time we were told cholesterol and fat were evil, we were told sugar was harmless. Sure it was. Just empty calories. I remember learning in medical school that the only people who needed to worry about sugar were dentists. What's to worry about? Filling cavities put their kids through college. Please. That's job security. From a dietary standpoint, this wasn't the end of the world. Who doesn't like sugar? I love sugar. That was an easy move for me. I don't think I ate fat for like 20 years. Remember Snackwells? 0 fat in Snackwell cookies. Those little sandwich cookies were fire. I could eat an entire box in one sitting. Absolutely no fat. Free calories, just like drinking water or breathing air. Right? Upcoming posts on how drinking tap water and breathing chemical air are slowly killing you. Just kidding. Not really. Overnight, fat was gone. The food industry pulled all the fat out of food and replaced it with sugar. In addition to all the new low and no-fat foods on shelves, other exciting fake foods were ushered in to take the place of fat. Grocery store shelves were lined with beautifully packaged, ultra-processed, non-fat, food-like substances, like Snackwells. What could possibly go wrong? Well, a few things actually. 30 years after the first statin medication was approved, and 40 years of us eating nothing but sugar, this unfortunate information was revealed. A report published from UCSF revealed how the sugar industry influenced the national conversation on heart disease. A newly discovered cache of industry documents revealed that the sugar industry began working closely with nutrition scientists in the mid-1960s to single out fat and cholesterol as the dietary causes of coronary heart disease, and to downplay the evidence that sugar consumption was also a risk factor. Funny little world. The sugar industry in bed with the guys making cholesterol-lowering medication. Collusion? Well, I never. Turns out, science has been bought and sold since science was science. They lied. And they lied about lying. The University of California, San Francisco published these inconvenient documents in the Journal of the American Medical Association, revealing scientists were paid off to produce fraudulent studies implicating fat and cholesterol as the most likely causative factors in heart disease. See, that's why you don't lie. Lies always come out. Don't do it. Just be honest. Decades of industry sponsored research, gazillions of dollars in hush hush agreements, corruption at the deepest level between big sugar and big pharma. Try as they did to make fat and cholesterol the root of heart disease, scientists knew it was something else altogether, something they hoped to keep secret forever. But it was right there, hiding in plain sight. It was sugar. The internal documents confirm the Sugar Research Foundation had a lot to lose, but even more to gain. When refined, sugar was like heroin. Processed sugar is 8 times more addictive than cocaine. High fructose corn syrup is even worse. Just like the drug cartel, they paid off scientists, 3 Harvard professors to be precise. They paid them to produce studies showing sugar was good and fat was bad. Can you believe this? I mean, this is Harvard. I never in a million years would have thought Harvard would hire anyone capable of falsifying their publications. Sorry, I could not myself. Fun fact, the documents uncovered by UCSF also disclosed one of the Harvard professors that was paid to publish fraudulent research on sugar is good and fat is bad went on to be named head of the USDA. You literally can't make this stuff up. That same criminally run USDA went on to develop the 1977 dietary guidelines to restrict real God-given foods like butter, red meat, and coconut oil because they caused heart disease. Eat all the processed sugar and refined grains you want. Grains are the foundation of the food pyramid. Sugar is an empty calorie. Fat will kill you. So fat was gone. Cholesterol was down, heart disease rates should have hit the floor, right? Yeah, no, that didn't happen. Heart disease actually went up, way up. Rates of heart disease tripled, to be precise. Okay, so we have Ansel in bed with big sugar and big sugar in bed with big pharma. We have an inconvenient truth that needs to be buried. Time to call in big science. Big science rescues the lipid hypothesis. The Framingham study, one of the major landmark trials sold to the public, sealing the deal on the causal link between cholesterol and heart disease, was the Framingham study. This was a large study that followed 5,000 patients over several decades and published several risk factors observed to be associated with the development of heart disease, including diabetes, smoking, high blood pressure, and high cholesterol. The investigators did find a correlation between cholesterol and heart disease. Home run for pharma. But it was only in a small subset of people in the study, people with something called familial hyperlipidemia. Familial hyperlipidemia is a genetic condition which affects about 1 in 300 people. These folks have impressively high total cholesterol levels, typically over 300. In those patients, there was an observed correlation between high cholesterol and heart disease risk. Time for industry to celebrate, right? Maybe not. What was more interesting was that there was no difference in the cholesterol between familial hyperlipidemia patients who developed heart disease and those who didn't. What? The gene responsible for causing familial hyperlipidemia also increases risk for clotting. That will be important later. Remember that. So, to restate, Framingham studied thousands of people and their associations with various risk factors for heart disease. Here were their conclusions in terms of which ones increased risk. Smoking, yes. Diabetes, yes. Hypertension, yes. High cholesterol, yes. But The cholesterol heart disease correlation wasn't found throughout the study. It was only observed in this one group of participants with really high cholesterol levels due to the genetic condition, familial hyperlipidemia. But when evaluating those participants as a separate group, there wasn't any correlation between cholesterol levels and heart disease. That detail may or may not have been incidentally left out of the study findings. A completely unreported finding was that as cholesterol levels went down in older participants, mortality went up. So if you were 65 or older, death from any cause went up as cholesterol went down. According to Framingham, you want more cholesterol as you get older, not less. The numbers game. I'm going to sidebar over here to something that makes me positively crazy. Misleading stats. Mark Twain said it best. There's liars, damn liars, and statisticians. The results of your drug trial suck? Who cares? We'll make them look good by spinning the numbers. Scientists can turn shit into gold with statistical manipulation. You'd be amazed or horrified at the mathematical gymnastics done by some investigators before submitting their studies for publication. I absolutely hated stats in college. You are likely going to hate me for the same reason after hearing this section, but it's important, so just hang in there with me for a minute. Absolute risk reduction. Absolute risk reduction is a real number. Let's say we do a study where 10 out of 100 people in our control group or the no treatment group have a heart attack. In our treatment group, only 5 out of 100 people have a heart attack. Absolute risk reduction is just the difference between the two. 10% minus 5% equals 5%. That's it. 5% fewer people had a heart attack because of the treatment. Relative risk reduction. Relative risk reduction is statistical gymnastics. It shows how much risk is reduced in relative terms compared to the original risk. See, it already sounds shady. The relative risk reduction is calculated as the absolute risk reduction divided by the risk in the control group. In our above example, that would be 5% divided by 10% equals 50%. Wow, that sounds much more impressive, doesn't it? This means the treatment reduced the risk of a heart attack by 50% compared to not getting the treatment. Even if that sounded all gobbledygook, you can see how I took the exact same findings, the words risk reduction, and arrived at two totally different conclusions. That vaccine reduces my risk for infection by 5%? No, thank you. By 50%? Now that you'd consider. Absolute risk reduction is also referred to as numbers needed to treat. And that's exactly what it sounds like. How many people need to take this drug to prevent one heart attack? In my example here, the numbers needed to treat is 20. 20 people need to take the medication for one of them to avoid a heart attack. That also means 19 of those people get zero benefit, but are subject to the same potential for harm or side effects from the therapy. Apologies for grinding you all through this, but this very basic misunderstanding of benefit and risk is extremely common amongst medical professionals. It's referred to as health illiteracy because your doctor is just as illiterate about statistics as you probably are. Physicians are taught about informed consent, but I took stats in college, not med school. I bet any money if you asked your doctor if the risk reduction they were talking about was absolute or relative, they would have absolutely no idea what you're talking about. Keeping everyone in the dark about the numbers makes us all easy to manipulate. Science uses absolute risk to report potential harms and then turns around to use relative risk to report benefit. It's insane, but it's classic industry BS. This is one of my favorite examples, the Jupiter trial. The Jupiter trial was massive. It included an incredible 18,000 participants. It was perfectly positioned to lay down the hammer on any doubt the industry had on its superstar statin, Crestor and its earth-crushing power over heart disease. Dr. Stephen Nissen, director of cardiology at the Cleveland Clinic, proclaimed, "It's a breathtaking study. It's a blockbuster. It's absolutely paradigm shifting." Paradigm shifting? Oh my God. Are you ready for it? Participants taking Crestor had a 54% relative risk reduction in deaths due to heart attacks. 54%? That's incredible. Call the White House. It sounds almost too good to be true. Because it is. 54% relative risk reduction converts to a 0.41% absolute risk reduction. To be clear, the landmark study that had everyone salivating over Crestor had a 0.41% absolute risk reduction. Less than 0.5% of study participants experienced benefit. And these odds are the best of the best. A drug company funded this trial. This is their own data. Check it out for yourself. I wish I was lying too. Less than 0.5% benefited from taking Crestor. This mentally ill math is done intentionally to mislead consumers. Pharma knows how to spin data, cherry pick it, extort it, and when it's not convenient, make it just disappear. It's unethical. It's immoral. It's outright deception. I'm a medical doctor, but I might not be your medical doctor. This is not medical advice. Saying that doesn't seem to help these days. This is just me telling you the numbers based on these stats I just taught you against your will. If we look at the data in terms of relative risk reduction, it doesn't look too bad. If we remove the smoke and mirrors, however, it's just plain terrible. Here's what we know from the available data on the potential benefit of statin therapy, which comes almost exclusively from industry-sponsored trials, citing data couched as relative risk reductions. So even with the shenanigans, this is as good as they can make it look. For high-risk people, people with known heart disease or at high risk for developing heart disease in the next 10 years, 39 people need to take a statin medication every day for 5 years to prevent one non-fatal heart attack. Low-risk people. These are people with a less than 10% chance of having a heart attack or stroke in the next 10 years. 217 people need to take a statin medication every day for 5 years to prevent one non-fatal heart attack. I don't know about you, but I find this underwhelming at best. Want to know what the numbers needed to treat for Tylenol is? Tylenol? It's 2. You need to treat 2 patients with Tylenol for 30 minutes to alleviate 1 headache. Even that's pathetic. I should also mention that there is, in addition to being almost all industry-funded trials, the researchers remove any participants who had side effects from these statin medications. Again, I can't even believe this. It's called pre-randomization run-in. It just helps them pick the most suitable candidates for the study. If you have a heart attack, your cardiologist is going to put you on a statin, period. Without even knowing what your cholesterol is, you are leaving that hospital on a statin. Let's say you take that statin medication for 5 years without side effects, because remember, they took those people out of the trials. You do so with the understanding that if you don't, you're going to die from another heart attack, right? Maybe not tomorrow, but sooner than you otherwise would. Okay, on average, if you take that statin for 5 years, how much would you think taking it would add to your days here on Earth? A few extra months? Several years? Nope. Guess again. 4.2 days. 4 days? Are you serious? Those had better be some good days. Good grief. Harms from statins. Statin side effects are extremely common. More than 50% of patients who have been prescribed one stop taking it within 1 or 2 years due to side effects. Pain and fatigue are the most reported adverse events, but there are others to take note of. These medications are not benign. They carry real risk for potential harm. No drug is without risk. No good comes without some degree of risk. We don't always jump into something for which the full extent of risk is known. I get that. But we know that there are well established risks associated with statin medications. You should be informed of what they entail. Here are some of them: liver toxicity, muscle damage, memory loss, erectile dysfunction, increased diabetes risk, mitochondrial damage. In contrast to their potential harms, we believe statins have two slightly beneficial effects on the body. They can lower inflammation and decrease the risk for clotting. Given that heart disease is one which involves both inflammation and clotting, this is interesting. These effects might explain why patients who have already had a heart attack seem to demonstrate slight benefit from taking these medications. The real deal on cholesterol. Look, cholesterol is important. We know this because every single solitary cell in your body makes it. Cholesterol is a key component of every cell membrane. Your brain is a great big ball of cholesterol. Low cholesterol isn't good. Often it's bad. Low cholesterol is associated with shorter life expectancy, mood disorders like depression and suicidality, and low hormone levels. The bottom line is this: cholesterol does not and cannot cause heart disease by itself. Heart disease is an inflammatory disease that the liver is trying to repair. Cholesterol is sent to damaged arteries to repair them. It's insulin resistance, oxidation, and endothelial damage that result in cholesterol being found at the scene of the crime. That's why we find it there. It isn't causing the problem, it's there to help fix the problem. Let's say you arrive home to find your house is on fire. You see the fire department is there. Did the firemen set the fire, or are they there to put it out? Is there a correlation between cholesterol and heart disease? Sure, there is. But it's not at all straightforward and clearly not causational. The conclusion that cholesterol simply causes heart disease is weak at best. There is an association between the two because of multiple other factors. What really causes heart disease? Heart disease is a disease of the immune system. It is the result of inflammation and clotting. This increase in clotting and inflammation is largely the result of something called insulin resistance. Poor lifestyle choices, ultra-processed foods, lack of exercise, and smoking contribute to this vascular inflammation. When the arteries serving the heart become inflamed, they become damaged. The liver attempts to heal this damage by sending out a repair crew of phospholipids, protein, and cholesterol. That's why we see changes in lipid levels in the setting of coronary artery disease. Most people have absolutely no idea that they are walking around with prediabetes, insulin resistance, or metabolic syndrome. These are the real killers. Statin medications absolutely, unequivocally lower cholesterol. If they have any cardiovascular benefit, however, it's not because of their effects on lipids. It's because statins have slight anti-inflammatory and blood-thinning properties. I would liken their benefit to that of aspirin. Perhaps this explains the Framingham findings in patients with familial hyperlipidemia. The attack on total or LDL cholesterol is completely misguided. We have so many other biomarkers for heart disease that are far better. A test called cardio IQ, fasting insulin, hemoglobin A1C, coronary calcium score, HSCRP, homocysteine, total cholesterol to HDL ratio, triglyceride to HDL ratio. What can I do to lower my risk? Lots. Start here. Control your blood pressure. Control your blood sugar. Don't eat ultra-processed foods. Correct insulin resistance. Keep moving, but knock it off with the triathlons already. Manage stress. Quit smoking. The lower the better for total and LDL cholesterol dogma is over. Like most things in the health space, reducing risk for heart disease comes down to largely diet and lifestyle measures. I'll close with this article recently published in the British Medical Journal. You'll see why there is obviously no industry funding here. This work was the result of a 22-year trial on almost 180,000 participants aged 50 to 89 without diabetes, not on statin therapy. The researchers found this. Low LDL cholesterol was linked to higher odds of dying from cardiovascular mortality. LDL of 100 to 189 milligrams per deciliter had the lowest risk of long-term mortality. High total cholesterol or high triglycerides to HDL ratio increased risk of heart attack. Only a fraction of people with cardiovascular events had high cholesterol. Conclusion. While statins have a well-documented effect on lowering cholesterol, the rest of the story leaves us in a bit of a quandary. According to the data that any one of us can read, here's what's been shown. LDL cholesterol does not cause coronary disease. High cholesterol is protective against all-cause mortality in older patient populations. Statins do not appreciably decrease cardiovascular risk. Outside of slight anti-clotting and anti-inflammatory properties, statins have an unfortunate side effect profile. The low-fat, high-carbohydrate diet increases risk for insulin resistance. Insulin resistance is the number one driver of atherosclerosis, or heart disease. Metabolic markers like triglycerides, HDL, hemoglobin A1C, and fasting insulin are much better indicators of risk and of the real pathophysiology that drives heart disease. But again, that's just what the science shows. Before making a medical decision, you deserve fully informed consent. You want to understand what's wrong, what your treatment options are, what are their risks, what are their benefits. Ask questions. Expect answers. Your doctor should have them, or at least be willing to find them. If not, look for one who does. It's you who makes the call in accordance with what you believe is best for your body. Don't forget, you are the patient. It's your body. Us doctors over here, we work for you. I don't believe statins are going to save us from heart disease. In the end, keeping those vessels open is about way more than cholesterol. It's about nurturing the entire system, from the food we eat, to the way we move, to the time we dedicate to sleep, to the way we manage stress. Our system operates as one cohesive network of energy. We need to optimize each and every part to ensure our heart has the best chance to thrive. Take good care of your heart. It's the only one you got. That'll do it for me. Thanks for watching, everyone. If you found this information useful or entertaining, please like the channel, subscribe, and share with a friend. Those things really help us out. Until next time, keep learning, keep questioning, and know that you are in charge of your own healthcare. We'll see you for the next one. Bye for now.